the science gal.
Inertia is a property of matter.
Nicola the science gal. Hi everyone, and welcome back to Nicola the science gal. Today, spoiler alert, we'll be busting a common healthcare myth. Like many of you, I am keenly aware of the amount of waste that's being generated in our healthcare system. And as many of us also know, there's been a recent push in these past years to switch to reusable items in our personal lives, like coffee cups and shopping bags. So it got me thinking, why can't we switch to reusable items in our healthcare practice? Especially gowns, which are the second most used item of PPE, right behind gloves. It's clear from many studies, including articles by McNeil et al. In 2020, and Fazzola, Overcash, and Griffin in 2020 as well, that reusable gowns outperform disposable from an environmental standpoint. In fact, the production, servicing, and disposal of reusable gowns have been shown to consume less energy, less water, emit fewer greenhouse gases, and generate less solid waste than disposable gowns. To provide a visual, this represents one reusable surgical gown, and these represent all the disposable gowns that it would replace in its lifetime. Reusable gowns can be reused in the surgical setting 60 times before being repurposed, making them economically and environmentally more sensible. So, what's the hang-up? In the last 30 years, hospitals, particularly in high-income countries, have been increasingly using single-use, disposable supplies, which are seen as superior from an infection control perspective. But are disposable gowns really safer than their reusable counterparts? Or is that just a healthcare myth? Well, due to my spoiler alert, and the short answer is disposable gowns are not safer than reusable based on the research I found. In fact, disposable gowns have been called into question in recent years when it was found that during the Ebola crisis of 2014, a portion of disposable gowns were found to be defective, exposing healthcare personnel to infected patients. McNeil et al. 2020 notes that despite the overwhelming adoption of single-use supplies in hospitals, there's no compelling evidence that they reduce healthcare-acquired infections. There's a multitude of different factors that contribute to a hospital-acquired infection, and occurrence of these is low enough that studying a single intervention would require an enormous sample size, something to the effect of 500,000 participants. McNeil et al. Also adds that most of the decrease in surgical site infection rates from 1987 to 2009 can be attributed to the use of evidence-based protocols to standardize care and enhance host defense mechanisms. So, for example, glycemic control and temperature regulation. Now, it wouldn't be Nicola the science gal without a little demo. So, historically, reusable surgical gowns were made out of cotton. And, as you can imagine, cotton is not overly effective at resisting fluid penetration. So, I wondered if this was where the origin of the myth came from. Present-day reusable gowns, however, are made of cotton polyester or PET blend fabrics, which allow them to meet safety requirements. So, both types of gowns are safe right out of the package, but what about after laundering a reusable gown? A surgical grade reusable gown can be reused around 60 times, but wouldn't all those washings affect its integrity? Unlike this gown here, no. In a study that compared the performance of disposable gowns and reusable, both new and after several wash intervals, no statistically significant differences were found, meaning that washing doesn't affect the performance of reusable gowns. Speaking of safety requirements, it's important to know that regardless of if a gown is disposable or reusable, it must meet strict performance requirements set out by the Association of the Advancement in Instrumentation, AAMI. There are 4 levels of protection, with 4 being the highest, and the levels are made depending on the level of protection required. Each level has specific requirements for impact penetration and hydrostatic pressure resistance, which both test the durability of a gown to fluid exposure. Kind of like testing the waterproofness of a rain jacket. So it's pretty clear from the research I've shared that reusable gowns are just as safe as disposable ones. So then why do we want to know about that as nurses? If you're like me, disposable versus reusable is a conversation that you've had or will have. When this conversation arises, you'll already have the information and resources to support your ideas, rather than just speculation that reusable is better. It is much easier for others to discount ideas when they're not backed up by research. Education on this topic can make you a leader when it comes to deciding what supplies to order on the unit. And as nurses, we have the hands-on experience to know when something like reusable or disposable gowns work or don't work, and the research skills to know why. This can and should make us leaders in deciding what supplies to have on the unit. Not only are reusable gowns safe, but according to research, they are more economical and in the long term would save the healthcare system money. And saving the healthcare system money is a great thing to know when proposing new ideas to management and even health authorities. Saving money on supplies could also allow for more funds to be directed to optimal patient care and staff support. Well, that's it. We've busted the myth. Thank you so much for tuning in today. I hope it was educational and that you can take this information forward and change minds and change healthcare. Bye! Nicola the Science Gal.